Good afternoon, everyone. My name is Christina Wilkerson. I'm a student with Northwestern State University. And today we're going to just talk a little bit about SCDs, Sequential Compression Devices. And after talking with Randall, we were kind of like thinking about some things that is a need that needs to be taught, in this area of the hospital. And basically, what we came up with is post-op care and the need to use SCDs during that time. First, I want to talk a little bit to you all about what SCDs are. And SCDs are mechanical devices used to reduce the development of deep vein thrombosis in immobilized patients. It consists of an air pump that is connected to those disposable sleeves, and air is forced into these sleeves in sequence, creating pressure around the calf to improve venous circulation. So basically, just with that intro, today my objectives are going to be the importance of using SCDs during post-op care. Okay? So why do we use these devices during post-op care? Is to reduce venous stasis, which is impairment of venous blood flow, and to reduce the risk of deep vein thrombosis, which is the formation of blood clots. Who's at risk for venous thrombosis is immobilized patients, patients that is on prolonged bed rest, and of course our post-operative patients. We're going to talk about setting up your device, and I know a lot of this may seem basic, but before we started this, before I even set up any education on this, I asked a couple of nurses what do they think SCDs are used for and things like that. And some of the questions, some of the answers I received was some say, oh, it's for blood clots. Then there were some that said, I don't know, because we don't use that in my department. So I, again, that's why we found it a need just to go on and educate you guys, bring us all back to the basics so we can all be on one accord when we're caring for our post-op patients. But anyway, when we first get the machine, this is actually how the sleeves look, and we'll get more into detail in the demonstration phase of this presentation. But you would take, first there's a little air pump box that you use, and first you want to make sure that the equipment works. You want to make sure that the cords and everything is free of hazard. And once that is done, you want to connect your tubing to the machine. And they're working on getting us a machine now, so just be patient. By the time that phase of the session comes, we'll have a machine here where we can connect the tubing to the machine, and I'll demonstrate that for you guys later, okay? After we check our machine and everything to make sure that it's working appropriately and things like that, we want to first verify the physician's orders. A lot of times, we think that we don't need an order for it because it isn't anything that's really invasive, but you do need a physician's order to apply SCDs to someone's extremities. Second, once we enter the room, of course, we're going back to the basics. We want to educate our patients. We want them to know and understand why we are applying the SCDs to their extremities. And if they have any questions at that time, explain it the best we know how in simple terms. We sometimes get mixed up and do a lot of this medical jargon thing, but we got to realize that the patients is not the nurses or the doctors, and so we have to make sure when we do educate them, we educate them in plainer terms. Next, we want to assess the extremity for skin breakdown, then apply the sleeves, turn it on, and then assess your device at least once a shift to make sure that it's on properly or that your patient still has it on. Because believe it or not, sometimes you go back into the room, the patient has taken it off because it's aggravating them or it's made them hot or it's made them itch. So just be sure to kind of like monitor your patient and make sure that they are wearing them as ordered. Okay? And lastly, the one greatest associated risk with SCDs is fall risk. I know a lot of people are like, fall risk? Yes, fall risk. They get up, sometimes they forget that they have these things that are on their lower extremities, then they get out of bed, and believe it or not, both young and old, they trip because they're connected to the device. So just remember, that's part of your education when you talk to them about applying the SCDs, that remember to unhook if they get out of bed without us knowing that they're out of bed. Okay, and that's really all the information that I have. It's very basic. Like I said, we brought it back to the basics because it was a lack that we had here at the hospital in terms of using SCDs in post-op care. So I thank you all for coming, and we're going to cut the video now here for short for school purposes, and then we're getting into demonstrating how to connect the sleeves to the machine, and we're going to, kind of like practice on each other's. It's very basic, and applying the sleeves to each other. Okay, thank you guys.